Are you currently suffering from deep hip or groin pain? That's worse first thing in the morning and then better as you move around for about 30 minutes? If so, these are classic signs and symptoms of hip OA or hip osteoarthritis. And unfortunately, a lot of us believe that this is a mechanical wear and tear, which means the pain means you shouldn't move, and the more you move, the worse it's going to get. But today, together, we're going to empower each other to show that this is a condition that is very well managed with exercises and can help restore your function and improve your quality of life dramatically, pretty simply. Welcome back, everyone. My name is Dr. Zach Greenwood here at Performance Sport and Spine in Seattle, Washington. And today I'm going to show you a comprehensive list of all these exercises that you can do to help get you back to life and feeling better. For hip OA, it affects the hip joint, which is the ball and socket. This is your pelvis. You have your low back or your lumbar spine, and then your thigh bone, which is the big bone in your upper leg or the femur. Now, this condition can affect both the ball and the socket part, and this often leads to reduced range of motion, pain, and stiffness. Now we know where it is and what's causing it. Here's some easy ways to know if you have it. So the first is going to be pain or stiffness putting on your socks. When you bend over and try to pull that sock or shoe on, it's going to feel tight and restricted. Number two, trying to sit on the floor. So if you try to get down like to play with your grandkids and you try to cross your legs, it's going to be really hard and difficult. Three, getting in and out of your car. So lifting that leg up is going to feel restricted or pinched. And then lastly, reduced range of motion. Most notably an abduction, which is raising your leg out to the side, or rotation, so moving that leg back and forth. In this video, we're going to focus primarily on why exercises are important and then giving you a comprehensive list. If you want to dive way deeper into this topic, here's a video that you can click on where we cover it in depth and a bunch of research on it. It's a common belief that hip OA, or arthritis in general, is this mechanical wear and tear, which means the more you do it, the worse it's going to get, similar to driving your car. But we as human beings are biological entities that have this amazing ability to adapt and recover. Also, arthritis is more complex than this. It involves inflammatory processes, biochemical alterations, and changes to the joint structure itself. So over time, your cartilage in your hip is going to wear down a little bit. That can cause reduced mobility, pain, and stiffness. But this breaking down is more than just biomechanical. It involves other things like inflammation, changes to the joint mechanics, and changes to the tissues itself. There are also systemic factors to play, most notably obesity and genetics. With obesity, it's more than just the weight on the joint. There are systemic hormones and issues with that actually damage the cartilage more. So these definitely play a progression in hip OA and arthritis in general. So this is more than just a mechanical wear and tear. So exercise can really help manage hip OA and alleviate your pain. When you do regular exercise, it helps strengthen the muscles around the joint. It helps improve those biomechanics we talked about, and it can actually be anti-inflammatory. As well as when we exercise, we produce these natural endorphins that are pain-relieving mechanisms. So these actually help reduce your pain when you exercise, as well as they can reduce the inflammation that causes damage to the cartilage. Therefore, with consistent exercise and low-impact strength training, you can really manage this condition and improve your quality of life, reduce your pain, and restore function.